Care.
If you're afraid to have that Lasik eye surgery, but you want the same results, well, we've got the solution for you with Dr. Jeffrey Schultz from Lifetime Eye Care. How are you, doctor?
Good morning.
Good morning. Okay, what's an alternative to Lasik?
Well, we use a terminology, corneal molding, corneal refractive therapy, orthokeratology, difficult word, or just simply Ortho-K. It's a way of molding the cornea so we get the same effect as Lasik.
So why should people choose the corneal molding over the Lasik? Is it just an easier procedure?
Well, many people are afraid of Lasik. The idea of surgery in general, eye surgery is very imposing on people, and they just say, I'm not going to do it. They're afraid of pain, and with corneal molding, there is no pain.
And obviously, when people wear eyeglasses or daytime contact lenses, that's when they want to get this procedure done. Now, you said there are 5 reasons why people, don't want to wear this, and I think it's an interesting list. So I want to show that. And the first one is vanity.
Right. Many people do not like to wear glasses. There's just the stigma that the idea of glasses makes them look different, not pretty for a woman. Just the inconvenience of wearing glasses.
And secondly would obviously be dry eyes.
Dry eyes. People will often complain about dry eyes with contact lenses. They don't like the discomfort. The day goes on, the lenses get drier. There are newer solutions available for contact lenses, but doesn't always solve the problem.
And dusty work conditions.
Dust gets behind the contact lens. It's painful. It's uncomfortable.
Swimming and other sports?
You can't do it. You can't. Obviously, the contact lens, today's lenses, the vast majority are soft lenses, and that soft lens is 50% water, and it absorbs whatever's in the water, and we can get infections from that. Or the lens will just simply float off the eye.
Now, lastly, and this is something that I've always thought of, the contact discomfort. When I've seen my friends put that in, it just looks uncomfortable.
Well, many people are willing to put up with contact lens discomfort to avoid the glasses. Again, we get back to that vanity issue. But there's a point where how long are they able to tolerate the discomfort? Is it an hour? Is it 5 hours? Is it 10 hours? Normal wearing day is 12 to 15. Maybe they can't make it that long, and that's where this comes into play.
Well, you had mentioned earlier Ortho-K.
Ortho-K.
What does that treatment involve?
It takes fitting a rigid gas-permeable contact lens that you wear while you're sleeping. And 6 to 8 hours, and morning you take that lens off, go your merry way, and it lasts most of the day.
So if you're describing this, and if I'm comprehending this, it would be like braces, like molding your teeth, you're molding your...
Exactly. One of the things that we often compare orthokeratology to is the term orthodontia. Orthodontia, the dentist uses braces to move bone on bone so the teeth shift into a different position. Orthodontia literally means straight teeth. We have the idea of the normal cornea, and then we look at what the cornea is supposed to look like afterwards. And whether we're dealing with Lasik or Ortho-K, we have straightened the cornea, we have flattened the cornea out. In the image now, what we're looking at is the contact lens sitting on the eye, making gentle contact with the center of the cornea. And there's a little gap there that you see at the outer edges. In the bottom view, you see the cornea now moving and shifting so that it is now flat across the front surface. We have not cut anything away. We have not caused any pain or discomfort. We have simply shifted the position of the cells on that front surface of the eye.
Okay, well, I don't even know why people would want this, but would it be possible to have that Ortho-K procedure reversed?
Ortho-K is great because if you don't like it, you just stop wearing the lenses. The eyes go back to their prior shape within a day or two. Back to wearing your glasses or contacts, but you're no worse for wear. Whereas with LASIK surgery, you're stuck. It is a permanent situation.
Okay, well, doctor, thank you for coming on. And I do want to mention, Dr. Schultz is kindly enough to offer a no-charge consultation for anybody that's interested in the Ortho-K treatment to eliminate need for glasses. I'm just going to say Ortho-K because that word's safer. Long for eyeglasses or daytime contact lenses. And if you do want to contact the Lifetime Eye Care Center, just call 216-581-8484 or go to myeyedoc.com. Doctor, thank you very much.
Michael, thank you so much.
Have a great day. I'm going to toss over to Eileen for some good summer corn recipes.
Oh, you betcha, Michael. In fact, Bill